Hello everyone, I'm Dr. Motahare. Welcome to the Art of Medicine. Today we'll talk about chronic cough that we know it's so bothering. We will talk about its causes and also how we can diagnose the etiology and also treatment options. Let's dive in. Chronic cough is defined as a cough that lasts beyond 8 weeks for adults and 4 weeks for children. It's a common clinical presentation and has multiple possible underlying causes. The prevalence of chronic cough ranges from 10 to 20% worldwide. It tends to be more common in women and also in smokers. It significantly affects daily life, sleep, and emotional well-being. The most common causes of chronic cough is the following things. The first, post-nasal drip due to rhinosinusitis, allergic or infection. The other one is asthma. And the third one is gastroesophageal reflux disease, GERD disease. Okay, there are other things like chronic bronchitis that is occur mostly in smokers, certain medications like ACE inhibitors, and less commonly more serious things like cancer or interstitial lung disease. Symptom varies depending on the underlying etiology. Patients usually present with a persistent cough, sometimes productive, sometimes dry. If it's associated with asthma, we can hear wheezing. If it is associated with reflux, we can have heartburn. Or if it's associated with post-nasal drip, we can have nasal discharge or face fullness, a kind of pain in the face, things like that. And sometimes shortness of the breath. The diagnostic approach begins with a complete history and physical exam. We'll ask about the presence of post-nasal drips, the sinusitis symptoms, heartburn, abdominal pain, or the triggers of the cough, the stimuli that will trigger that cough, how it will be relieved, how patients can manage the cough, if it is productive or it's dry, is there any smoking history or not, is there any alarming sign like weight loss, night sweat, or severe night cough or not. After that, based on all information, we will begin other investigations. Sometimes we need an X-ray to rule out other underlying disorders. Pulmonary function test is also very important for diagnosis of these disorders like asthma. And post-nasal drip can be visualized with a simple examination. If the cause remains unclear, we will do some more tests like a CT scan or bronchoscopy based on things that we are thinking about. Treatment of chronic cough depends on the underlying cause. Sometimes when we are suspecting gastroesophageal reflux or post-nasal drip, we can start an empirical therapy, a short period of treatment in order to see any improvement in the symptoms or not. For post-nasal drip, we can use nasal washing, antihistamines, or some kind of nasal drugs, nasal steroids. For GERD, gastroesophageal reflux, we will advise patients to change the lifestyle and also start some medication. If the asthma is a problem, it's a different category that should be treated based on patient's factor. If we are suspecting to chronic obstructive pulmonary disease, also the treatment option is different. And the top of them is smoking cessation. And if the cough is related to some kind of medication, when we stop that medication, this cough will go away. But the doctor should make this diagnosis. And if any drug is stopped, doctor will replace it with another drug that do the same benefits for the patient, but without that adverse effect. This is please pay attention. We will not stop any medication on ourselves. This is a doctor's decision. I know that chronic cough is so bothering, and sometimes it's really hard to live with a chronic cough. But always first consider the three main diagnoses: post-nasal drip, very important, reflux disease, and also asthma and its related symptoms. And after that, if the symptoms continue, then we will think about the other causes. Thank you for joining me today. I hope you have a better understanding of chronic cough. Don't forget to subscribe for more medical education. Thank you.